Okay. So read the last sentence. Which of the following diagnostic test is the most appropriate next step? Okay, and then all the answer choices are just kind of different imaging we do. Okay, so 45-year-old female presents to the emergency department with intermittent severe right upper quadrant pain that occurs after meals and lasts for approximately 1 to 2 hours. The pain is described as sudden, sharp, and colicky. She also reports nausea, but denies fever, vomiting, or changes in bowel movements. Her past medical history is unremarkable. On physical examination, her right upper quadrant is tender, but without guarding or rebound tenderness. Lab tests revealed normal liver function tests and normal white blood cell count. Which of the following diagnostic tests is most appropriate next step? So right upper quadrant, I'm thinking gallbladder. There's no white blood cell count, so I kind of don't really think infection. The first thing I think of is like stones, and I know with
Okay.
gallstones you usually do a ultrasound. So I guess it'd be ultrasound the right upper quadrant. Yeah.
Yeah, good. So you're working through this question really good. It's been a long time since we worked together, but your thought process is very, very clear. So, biliary colic is usually done by gallstones, right? She's not currently infected, so she doesn't have acute cholecystitis, right? But she has gallstones, right? And so she has biliary colic from time to time. So the best way to evaluate to confirm if she has gallstones is an ultrasound of the right upper quadrant, right? So you don't need to take this patient back to surgery or anything like that because she's, currently doesn't seem like she has acute cholecystitis. She's just coming in because she's worried, right? But other than that, exactly the next step in management is going to be an ultrasound.
Okay. And one quick thing. So I know it says white blood cell count is normal. Can't gallstones cause an infection, like if they're there for too long?
Yeah, so what you're thinking about is if a gallstone is currently, let's say, stuck in the cystic duct, right?
Mm,
What's going to happen is bile is going to bile can't be released and it gets stuck in the gallbladder. And that old bile can eventually get infected. And when that gets infected, that's called acute cholecystitis or inflammation, infection of the gallbladder, which and then you can get increased WBC. But colicky pain doesn't necessarily cause increased white blood cell count, right? Meaning that you're pushing a stone through a small tunnel, but it actually passes. That just hurts a lot, but it doesn't necessarily get infected. The infection happens if the stone gets stuck for a long period of time.
okay. And this is actually a perfect question because it's usually these questions that kind of trick me a little bit, where it's like CT scan, the HIDA, is it HIDA? HIDA?
HIDA scan, yeah.
HIDA scan, and then the MRCP. This was actually a question on my internal med shelf. And I read somewhere, I've gotten questions in the past where if it involves your gallbladder, the MRCP is one. The HIDA scan is also another one. So I guess this is a good question that can kind of help solidify my thinking for future questions is when do you kind of use those other two for any gallbladder related things?
Sure. So let's look here. HIDA scan is acute cholecystitis or bowel duct obstruction. Let's see. MRCP is imaging that can visualize biliary and pancreatic duct, useful for dissecting. Choledocholithiasis, so like common, the common bile duct, right? And but the thing is, MRCP is very expensive, right? It's not going to be first line, especially in this scenario, because like I said, all the patient has is biliary colic, meaning gallstones that are passing but not getting stuck. So all you need to see is, are there gallstones in the gallbladder? If the answer is yes, then you have your diagnosis, right? But like I think a HIDA scan, if I remember correctly, is HIDA scan is like an emptying of bile, if that makes sense. And so if there's an obstruction, then all the bile will be seen in the gallstone, but not being able to empty, like move through the cystic and common bile duct. But I can't remember exactly what diagnosis besides colodoco that you can use for, let's see, what do you use in uh, what is it again? HIDA scan.
Mm-hmm.
What? And also, I think you can use it for biliary sludge too, if the yeah, gallbladder dysfunction, right? Where it doesn't, your gallbladder doesn't contract and it kind of makes sludge and it doesn't move as well. You can use the HIDA for that too, because it's just the flow rate, if I'm not mistaken, for it's the flow of bile, if that makes sense.
Yeah. Okay.
Okay. And then MRCP, what diagnosis can you pancreatic gallstones, bile duct strictures, pancreatic tumor, and pancreatitis. So this is going to give you like a finer detailed image, but for basic things, you're not going to want to run an MRCP because a lot of stuff you can diagnose by clinic with ultrasound, which is way cheaper and doesn't take as long to do. So this becomes kind of that finite thing of we always talk about, you want to use the cheapest, the fastest thing for your patient, right? And not bring a bazooka to, like a knife fight. You know what I mean?
Yeah. Right. Okay. Yeah, that helps. Thank you.
Of course.